what this exhibit is showing is that every dot on here, it's probably obvious, but every dot on here is an Ontario hospital. All the hospitals are shown. And it shows that based on current practice of how everything is done today to keep pace with population growth and aging, how many more beds would every hospital in Ontario need, right? So that's what's shown on the horizontal axis. And the vertical axis is just the percent growth, right? So Trillium sticks out. That's the three-site hospital in Mississauga. They need 1,400 new beds over 20 years to keep pace with the growth and aging of their population. And then we've got the Muskoka sites labeled and also colored red on here, where the numbers are much smaller. I don't know exactly how to read them off of here, but the growth is about 65 to 75% in terms of the increase in the number of beds. And if you sum all these hospitals up, Ontario needs something like 20,000 new hospital beds over 20 years to keep pace with population growth and aging, which is one of the reasons why the government is not allowing every hospital to just submit plans saying, this is how many beds we're going to need to keep pace with population growth and aging. We have to assume improvements in the system of care that substitute other services for inpatient hospital care over time.
And that's where that innovation comes in of doing things differently in the health
Yeah,
system. And we heard recently that the Muskoka Algonquin Ontario Health Team and other Ontario health teams have been instructed to connect every resident with a care home. So
right.
currently we have about 10,000 residents without a primary care physician, and so there's been a new mandate that everyone be connected with a care home so that they're able to get medical care when they need it. And so those types of other initiatives that are happening and being funded and overseen by the ministry are supporting a change in how we do healthcare, right? So we're looking at doing healthcare differently. Um, so if the projections show that we need, 65 to 75% more beds based on the current uh, situation, then thinking about, okay, what do we do to be innovative and change the way that we're doing things? And I think the purpose is, folks don't want to be in the hospital, do they? They want to be at home. And so how do we get people living at home longer? And that's the idea and the foundation behind this plan.